Today, we're diving into a topic that affects millions of people worldwide: joint pain. It's that nagging ache or sharp pain that can really put a damper on your day-to-day life. Whether you're an athlete pushing your limits, a busy parent on the go, or just trying to enjoy your golden years, joint pain can really slow you down. But here's the good news. Understanding the cause of your joint pain is the first step to finding relief and getting back to doing the things you love. In this video, we're going to explore the top 7 reasons why your joints may be hurting. We'll break down each cause in simple terms, discuss the symptoms, and talk about what you can do to feel better. Remember, I'm here to give you the information you need to take control of your health. So, let's get started. First up, we have osteoarthritis, the most common type of arthritis. You can think of this like the wear and tear arthritis. It typically affects the joints we use the most over time, like our knees, hips, and hands. As we age, the cartilage, that smooth cushion between our bones, can start to wear down. This causes the bones to rub together, leading to pain, stiffness, and inflammation. You might notice it's worse in the morning or after periods of inactivity, and that's because the joint fluid that helps lubricate things hasn't had a chance to get moving yet. While there's no way to completely reverse osteoarthritis, there are things we can do to manage it and slow its progression. We'll talk more about that later in the video. Now let's talk about rheumatoid arthritis, which is a bit more complex. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune disease. This means your immune system, which normally protects your body from invaders, mistakenly attacks your joints. This attack causes inflammation in the lining of your joints, leading to pain, swelling, and stiffness. And over time, it can actually damage the joint itself. Rheumatoid arthritis often affects joints on both sides of the body, like both wrists or both knees. You might also experience fatigue, fever, and loss of appetite. Early diagnosis and treatment are crucial for managing rheumatoid arthritis and preventing joint damage. So, if you're experiencing persistent joint pain, don't hesitate to see a doctor. Next, we have bursitis, a condition that affects those little cushions in our joints called bursae. Bursae are like tiny, fluid-filled sacs that help reduce friction between bones, tendons, and muscles. When a bursa becomes inflamed, it's called bursitis. This can happen from overuse, injury, or even underlying conditions like rheumatoid arthritis. Bursitis often causes pain, tenderness, and swelling in the affected joint. You might notice it most when you move the joint or put pressure on it. Common areas for bursitis include the shoulder, elbow, hip, and knee. Now, let's talk about gout, a type of arthritis that can be incredibly painful. Gout occurs when there's a buildup of uric acid in the blood. Uric acid is a waste product that's usually filtered out by our kidneys. But when there's too much uric acid or our kidneys can't keep up, it can form sharp crystals in the joints. These crystals trigger intense inflammation, leading to sudden severe pain, redness, and swelling. Gout often affects the big toe, but it can also occur in other joints like the ankles, knees, and wrists. Certain foods and drinks like red meat, shellfish, and alcohol can increase uric acid levels and trigger gout attacks. Chapter 5. Moving on to tendinitis, a condition that affects the tendons, those tough cords of tissue that connect muscles to bones. Tendinitis is essentially inflammation or irritation of a tendon. It's often caused by repetitive motions or overuse, which is why it's common in athletes and people with certain occupations. Think tennis players, golfers, or even those who spend long hours typing on a keyboard. Tendinitis typically causes pain, tenderness, and stiffness along the tendon. You might notice it most when you move the affected joint or try to use the muscle connected to that tendon. Chapter 6. Let's not forget about injuries. Joint injuries like sprains, strains, and fractures can definitely lead to long-term pain and discomfort. A sprain is a stretched or torn ligament, those tough bands of tissue that connect bones to each other. Strains involve the muscles or tendons, and fractures, of course, are breaks in the bone. Depending on the severity of the injury, you might experience pain, swelling, bruising, and difficulty moving the joint. Proper treatment and rehabilitation are essential for healing properly and preventing chronic joint problems down the road. Chapter 7. Finally, let's touch on lupus, a chronic autoimmune disease that can affect various parts of the body, including the joints. Lupus causes the immune system to attack the body's own tissues, leading to inflammation and damage. Joint pain is a common symptom of lupus, often affecting multiple joints on both sides of the body. The pain can be migratory, meaning it moves from one joint to another. Other symptoms of lupus can include fatigue, fever, skin rashes, and kidney problems. Lupus can be tricky to diagnose because its symptoms often mimic other conditions. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and information. Remember, joint pain is incredibly common, but it doesn't have to control your life. By understanding the potential causes and seeking proper treatment, you can find relief and get back to doing the things you love. Stay healthy and take care of your joints.